again, everyone, and welcome to another edition of Smart Lawyers Love Dumb Nurses. I'm your host, Dr. Brian Smith, and today we are going to talk about communication. More than anything else we do as human beings, we send messages. We communicate with each other with varying degrees of effectiveness. We do it verbally and non-verbally. I want to focus on this podcast on how we communicate in our jobs. First, think about how the communication has been in your personal life. Mishearing and miscommunication is a daily occurrence in our lives. Communication must be considered a skill that everyone needs to add to their resume, especially nurses. The benefits of effective communication in nursing are often undervalued when they should be a highly sought-after skill. On-the-job communication issues are more heavily weighted because they can lead to more serious consequences. When team members talk about issues on their job, it is often communication breakdowns that are considered the main cause. Impeccable communication is critical for nurses. It is not just necessary, it is vital to give clear, accurate communication. It could be life or death in certain circumstances. It is not enough to hear what the patient or your colleague is saying. Nurses must listen to what is said. The need for clarity must be embraced whether you are communicating with a client, documenting, or speaking on the phone. One avenue that enhances our ability to convey our thoughts is using a kinder speaking tone. I decided early in my career to use kindness in my daily communication and also when teaching students. Kindness fosters open dialogue. It strengthens relationships. And it minimizes conflicts or misunderstandings. Kindness also places value on the input of others. It is better to err on the side of caution. I also prefer to err on the side of kindness. This is especially needed in the nursing profession. Kindness is a way to tell other struggling souls that there is still love in the world. This approach to teaching was born from the experiences I endured as a young nursing student years earlier. The unfiltered criticism and harsh vocal tone I received hindered me much more than it helped me. Degrading comments and drill sergeant mentality may have worked well for grandma's nursing education, but it does not fly in today's nursing school. I was never at my best when an instructor barked at me with an unsmiling face and uncaring tone. An intimidating teaching style created such a lack of self-confidence that I rarely performed with self-assurance. Research reveals that speaking kindly to plants helps them grow. Imagine if we spoke that way to people. I choose kindness and constructive feedback over harsh critiquing. Kindness is the residue of inner strength. Kindness makes you beautiful. However, be careful not to allow anyone to misinterpret your kindness as weakness. The goal is to be a messenger of hope and positivity. I recall one student who had been struggling with poor grades in her other classes, but she persevered and passed the course I was teaching. I asked her how she was able to pass my class, and she stated, "Because you were kind and patient with me. That is all it took." Kindness can have powerful, positive consequences. We often do not know the struggles others are going through, so when all else fails, be kind. Kindness kills the monsters. When I asked patients to describe the best nurses who cared for them, patients consistently replied with comments such as, "My nurse was so kind. She always had a smile on her face." Another one, "He seemed genuine. I could tell he wanted to take care of me." One comment resonated with me. "She looked directly into my eyes when talking to me. She listened to my concerns." Another patient told me she was impressed with her doctor because he got a chair, sat down beside my bed, took my hand, and did not seem in a hurry. He even wrote down my comments. The comparisons are striking, aren't they? Somewhere there is a stranger who still remembers you because of the kindness you showed them when no one else did. Kind words do matter. Kindness is not just an occasional occurrence, it is a lifestyle. Learn to speak in such a way that others love to hear you speak. Listen in such a way that people love to speak to you. One of the biggest communication problems we have is that we listen to reply. We need to listen to understand. Learn to be a good listener. You cannot be misquoted if you are listening instead of speaking. I don't trust words. I trust actions. Actions speak louder than words. We actually need to have more places besides libraries where people aren't allowed to talk. Don't you sometimes love the sound of no one talking? Positive communication includes our inner dialogue as well. Learn to speak positive and kind to your inner self. Your body hears everything your mind says, so please be careful what comes out of your mouth. If you don't have a good relationship with yourself, you won't have a good relationship with anyone else. Be kind to yourself because the person you speak to the most is you. Why do we continually allow negative thoughts to stop us? It takes away our power. Anyone or anything that saps your energy or makes you feel inferior or negative, get away from it. I love the feeling of walking away from things that are not meant for me. One example of negative inner dialogue is complaining. Some people are training as complainers like it is a competitive sport. Complaining gives you a victim mentality, so we need to quit doing it. And let's see what miracles can happen when we do. When you complain, half the people you complain to do not care. The other half are glad you're having a bad day. Repetitive complaining will attract things for you to complain about. Repetitive gratitude and positivity will attract things for you to be positive and grateful for. Don't be so quick to complain on social media either. Going to social media and telling your life struggles is saying, "I would just like to publicly announce that I have no idea what I'm doing." For years, I actually believed I was passionate about my life and my job because I complained all the time. Finally, my dear wife Patty brought this to my attention. Complaining triggers the body to release cortisol, the stress hormone. Cortisol shifts you into a fight or flight mode, which directs oxygen, blood, and energy away from where your body needs it the most. One consequence of cortisol is to raise your blood pressure and blood sugar so that you'll be prepared to either fight or flight. Excess cortisol from repeated complaining weakens your immune system, raising the risk of illness. Research has shown that complaining even makes you more vulnerable to high cholesterol, diabetes, heart disease, obesity, and even strokes. Complaining does not mean you are a passionate person. Passion includes positive energy, focus, and planning. Work for what you want instead of complaining or wishing for things. Listening to complaining is also damaging because our brains naturally and unconsciously mimic the moods of those around us. This mirroring process is the basis for our ability to feel empathy, but also suffer the ill effects. Avoid complaining, and instead of venting, write your complaints down. Read it aloud to the universe, and then crumple the paper and throw it in the trash. Symbolically offer it to God with a promise to stop complaining and to do better. All of us will suffer if we have an emotional reaction to everything said to us. It is a beautiful feeling when you remain calm when everyone wants you to be enraged, whether it's negativity, anger, or venting. If you are a strong-minded person, you can take what is said to you. If you are strong-minded, you will have restraint. If you allow words to control you, your emotions, your spirituality, your body, or your mind, then anything can control you. Words are just words. They disappear into the air. Even if the words are statements like, "You are not good enough," or "You should try another line of work," you can lie down for people to step on you, and they'll remark that you're not flat enough. There will always be people who talk behind your back. Move on from those people, because that is where they need to stay, behind your back. You are moving forward. Negativity is commonplace in today's society and should not be a reflection on you. And never worry why more good things are not happening to you. Remember, you are a good thing happening to other people. The two most important things in communication are to hear what is said and to hear what is not said. Not everything needs a reaction. Sometimes people say things to get a reaction from you. Silence is often better than words, because if someone doesn't understand your words, they may understand your silence. The right people will always hear you. People need encouragement more than they need to hear our opinion. You don't need a reason to help people. Positive communication is good energy, and it is contagious. You never know who needs you or needs to hear your message. But be careful with your words when you're angry. The tongue has no bones, but is strong enough to break a heart. We must be careful with our words. Your words can only be forgiven, not forgotten. A gentle answer can have a calming effect, but harsh words stir up anger. You lose your peace of mind when you give someone a piece of your mind. But again, you cannot be misquoted if you don't say anything. Rudeness is a weak person's interpretation of strength. Rudeness on the job seems to be more commonplace in today's society, even in nursing. Microaggression is a term I have unfortunately been exposed to for my entire nursing and work career. Microaggression is a verbal, behavioral, or environmental insult, whether intentional or unintentional, that communicates hostile, derogatory, or negative attitudes. I have seen and heard it directed at individuals and groups of people. I have always thought that ugly on the inside soon becomes ugly on the outside. There is certainly no place for it in nursing, and nurse leaders must advocate for their clients and colleagues should it occur. I have learned to live my life by 3 common rules. Number 1, have common sense. Number 2, have common courtesy. And number 3, have common decency. We have all heard the expression, common sense is not so common. Hate seems to be the underlying theme of the day. Road rage, dirty politics, fake news. The love of money may be the root of all evil, but hate and rudeness are sprouting up all around us. If you cannot be kind, then be quiet. If you think people will be sweet and kind to you because you are sweet and kind to them, you are fooling yourself. The best way to get negative people out of your life is to be positive. Negative people will go out of their way to avoid you. Pause before speaking about something you may regret. I call it the power of pause. We must be careful of our thoughts when we are alone, and to be careful of our words when we are with people. I want to talk to you on cognitive rehearsal. Cognitive rehearsal is a strategy I have practiced for many years as a healthcare professional. Cognitive rehearsal is a tool that promotes communication and respect. It allows you to prepare to respond to unprofessional behavior in a manner that's not considered retaliatory. It is the power of pause. Personally, it prevents me from acting impulsively. Rather than responding immediately or emotionally to some unprofessional remark or behavior, you pause and process what you hear or see. This allows you to think about the potential situation and what the most appropriate responses might be. Cognitive rehearsal is a process that starts with learning to recognize unprofessional behavior and factors that contribute to those behaviors. This allows you to respond positively when confronted with uncivil behavior or communication. It is also important with cognitive rehearsal to rehearse the responses in a relaxed environment to practice. Whether you are a nurse or in a profession where you interact frequently with others, you should be prepared to respond to a situation in a positive, non-threatening manner. It is also essential to prepare specific phrases to use if the encounter becomes uncivil. By utilizing a planned, rehearsed response, you create an opportunity to communicate expectations for appropriate behaviors in future interactions. For example, in response to a situation of sabotage or negativity, you could say, "There seems to be something you want to say to me. It's okay to speak directly to me." Another great response is, "Can you and I meet in private and discuss what you said?" Cognitive rehearsal provides a proactive strategy to take a stand against incivility and bullying in the workplace. Show integrity by calmly standing up for your rights and the rights of your patients, your customers, and your colleagues. Remember, poise, professionalism, and positivity are the hallmarks of an exceptional nurse. I think this is a good place to stop for this podcast today. My name is Dr. Brian Smith. Stay focused, stay inspired, stay tuned. Thank you for listening.